Public Health Solutions is a public health nonprofit in New York City that works to provide services and to support community-based organizations to address New Yorkers' most pressing public health issues. Every year, hundreds of thousands of New Yorkers avoid healthcare due to concerns about food, transportation, housing, and other unmet needs. They, by the time they seek healthcare, their health is in crisis and their lives are cut short. So our Whole U NYC network exists to change that trajectory and provide resources to more New Yorkers, because the right resources at the right time can save lives. Currently, we don't have a lot of visibility into how well the social safety net is providing for New Yorkers, because most services are administered and operated in silos. So we have a very fragmented picture of how well we are doing providing resources to New Yorkers. With our Whole U NYC network, powered by Unite Us, we're starting to have some visibility into what are the greatest needs and how well we are doing in addressing them. And in New York, we have real challenges with pockets of communities where there are food deserts or high-cost housing or lack of transportation access. And so it really varies largely depending on the community because of the diverse landscape of New York City. It all starts with introducing conversations about people's lives, about what needs they have, how they're doing economically, how they're doing with their families. Historically, those things have come up when people are already in crisis. So what we're doing is beginning to introduce those conversations where people are, at their community centers, at their schools, at the local YMCA, places where people naturally gather, and begin having those conversations early and systematically. Is there enough food on the table? Do they have a doctor they can trust? Do they have difficulty getting around? Do they have housing quality issues in their home? So currently we have no system for doing that. So we're really building that from the ground up, and that's where the access starts, creating those access points in the community where people naturally gather. In layman's terms, our health insurance is going to start to pay for things that historically it hasn't. We don't think, oh, my health insurance company can pay for food, can assist me with my rent, can get me a ride to my mental health appointment. Those aren't conventional uses of healthcare insurance. The Medicaid waiver begins to pay for some of those things through your plan. And so our goal with Unite Us is to build the infrastructure that supports organizations to deliver on that goal. We do the education. We go out in communities and say, hey, did you know that you can now start to receive these things through your health insurance plan? And Unite Us builds the pipes. And those are incredibly valuable pipes for the long run when you think about how we receive things like meals through Seamless or a ride through Uber. All the providers are there. They're all accessible. You don't have to pick one, they're all there. The onus is not on you to figure out and find the best resource for yourself. You just give your preferences. And so that's what we're building towards with Unite Us. The real challenge here is how to assess needs in the way that Medicaid will need us to do, but do it in a naturalistic way, in community, in a way that does not stigmatize or pathologize poverty, in a way that makes it easy for everyone to talk about their priorities and their preferences.